And well, winter weather can be depressing, and a lot of people suffer from seasonal depression. Joining us to talk more about the symptoms of seasonal affective disorder is Julie Hanks with Wasatch Family Therapy. Thanks for being here, Julie.
I'm happy to be here.
Do a lot of people struggle with this in the wintertime?
They do. About 500,000.
500,000 across the country?
Yeah. So quite a few.
Yeah, that's quite a few. So tell us how to recognize the symptoms and how you know it's just different from maybe from the blues after the holidays, the letdown after the holidays.
Yeah, so if it continues after the holidays, then you need to look into it. But the signs are oversleeping, craving sweets, weight gain, as opposed to weight loss. In regular depression, it can be weight gain or loss. Usually seasonal is weight gain. And we're like, wait, that's me after the holidays.
Yeah, everybody thinks, wait, that's me.
Yeah, oversleeping, difficulty concentrating. So all the symptoms of regular depression apply, but they tend to be oversleeping and overeating as well.
Okay, and so here in Utah, how do people suffer? Do people, compared to the rest of the country, do we see it more? Do we see it less? Do you know?
You know, in the northern regions, there's more seasonal depression because of the less sunlight. That tends to be the issue. And you know, Utah, I don't know if you know this, is #1 in the number of individuals seriously considering suicide.
I did not know that.
#1. The CDC just came out with that. So that's a sobering statistic. So depression is not to be taken lightly. It's really, really important to get treatment and to get help.
So what can people do if they think they are suffering from this?
Well, you can talk to your medical provider or a therapist. That's what I do. And get some help, get an accurate diagnosis. And there is treatment available. That's the great thing about depression. It's very, very treatable.
Now, what is the treatment? There are several forms of treatment.
Yeah. So one of the easiest things to do is just increase your exposure to natural sunlight. People tend to withdraw and stay inside during the winter, but when it's sunny, get out and exercise. Light therapy, the light boxes, have you ever?
Yeah, I have seen those.
Have you seen those?
Yeah.
So those can be effective. Psychotherapy, talk therapy, medication is also, SSRIs can be really, really helpful.
And regular sleep schedule. What does that mean, regular? I need to know.
Really. Well, yours would be different than mine. But you know, getting 7 hours of sleep every night, going to bed at the same time, and then also continuing to be social. When you're depressed, you tend to withdraw, but really force yourself to get out and be with people is also important.
And sometimes that does take a push.
It does.
Whether it's somebody else pushing you or you need to tell yourself, I need to go do this, even though I don't feel like it.
Exactly. You don't want to withdraw. That tends to make depression worse.
Okay, thanks so much for the information, Julie. And you can find more information on our website. It's today.ksl.com. We also have a link to Wasatch Family Therapy. We'll be right back.
Thank you.